thank you everyone so much for joining us today. We are so incredibly excited to be with everyone this very cold afternoon. So again, thank you all so much. We have a lot on tap for today. We're going to spend about the first half of the presentation or so going over the State of Aging report itself. We're going to be showing you a little bit about the data that is included, how you can find it and access it, and things of that sort. And then we are also very excited for the second half of this presentation to then move more into a panel conversation with two of the amazing folks who helped, I think, really shape a lot of the things that were involved in it. So that'll be with Diedre Johnson, who is the CEO and Executive Director of the Center for African American Health, and then also with Shannon Secrest, who is the Deputy Director of the Colorado Cross Disability Coalition. So again, that is what is on tap for today. Before getting started, did just want to mention just a couple of quick things. First, wanted to extend some thanks to a few folks. So first, wanted to extend thanks to the Next 50 Initiative, who funded this project and who has been a huge supporter of this. And without them, we could not have made this happen. So thank you again to the Next 50 Initiative for making this possible. The other group of folks that we really did want to extend a huge amount of thanks to, and we'll talk about this a little bit later on in the next little bit here, but we worked with an advisory group of folks who really played an instrumental role in helping to craft these recommendations. And so that was a group of 5 organizations, 2 of whom are here today. So with the Center for African American Health, and then also with the Colorado Cross Disability Coalition. So that was 2 of the 5 groups. The other ones that I'll just mention really quick here are One Colorado, Tri-County Health Network, which is down in Southwest Colorado. And then finally, also the Colorado Latino Leadership and Advocacy and Research Organization. Now, it's a little bit of a mouthful for me, but they're also known as CLARO. So all of those organizations, again, played a huge role in making this happen. And we were so incredibly grateful for their incredibly thoughtful feedback throughout the entirety of creating this entire project. The second piece that I will mention as well, we are also going to be as well having a panel conversation at the end of this. So if you do have questions as we're going through this, do please feel free to put them in the chat. And hopefully we will have a chance to get to those a little bit later on. So with that, we will go ahead and we will get started. The first thing that I just want to spend a little bit of time on, I think a lot of the folks who are probably on this right now kind of know a little bit about this already. So I think I'm talking to a lot of folks who already know this, but just to spend a little bit of time on this, because we always do get asked the question, why is the Bell Policy Center interested in our changing demographics? And I think that this chart, which you can see on the left, really showcases why that is. Over the next 30 years, and I will say that throughout the past several decades, that, this is a trend that we have already seen. So we're kind of you're only partly seeing, the entirety of the change. But if you take a look, you can see that our older population, those who are 65 and older, that is the fastest growing segment of our population demographically. And if we take a look at those who are in the older segment of that 65 plus, you can see that those numbers increase exponentially. And so why does that matter? I mean, if we want our policies and to be reflective of the needs of our population and the needs of our communities, this is something that we need to consider, we need to think about, and we need to have good, thoughtful policies for. So that is why something that the Bell Policy Center does pay attention to this. And that really gets to why we did this report and to begin with. I mean, as I had mentioned before, and again, as you can see from this chart, over the next 30 years, we are expecting to see a huge growth in our population of those who are 65 and older. And as we implement policies and as we implement different, pieces of work throughout our state, and I will say that there is a lot of great work that already is being done, I think likely by a lot of the folks who are already on this webinar. We're going to need to make sure that we're making progress. We're going to need to have a way to say, are we meeting the needs of our population? What does that look like for people? How are, are we saying we're doing what we wanted to be doing? What are some of the evolving needs and opportunities and challenges as we move throughout this cycle? And that's what we really intended to do with this report. We really wanted to create some type of benchmark to then say, in the coming years, we can look back and say, this is where we were in 2020. We implemented some of these different policies. What does it look like now? So in that sense, again, what we're really hoping to do with this is to create kind of a benchmark and as a way to kind of measure our success and look at those opportunities moving forward. So with that, what I will also say, and this is kind of inherent in having this be a benchmark, is that we want this to be, and we are planning on this being something that we continue to put out in the coming years. So this is kind of the inaugural State of Aging report, but then something that we will be coming back to in the coming years, again, to assess how we are doing. So the final thing that I will mention about this report, which I think is really important, and you'll see this in a lot of the data that I'll be showing here in just a little bit, but we know that aging does not look the same for every community and every older Coloradan. Instead, it does vary significantly and change very differently based upon where you are in Colorado, your race, your ethnicity, whether you are a part of the LGBTQ community, whether you're someone with a disability. Aging looks different for everyone. So what we intentionally try to do, and this will be something that we come back to in a bit, but we intentionally tried to disaggregate the data where we could to have a better understanding of what aging looks like in all different segments of our community. And again, I'll come back to that there, which gets to, I think, some of the other findings that we have. So again, that's kind of the basis for why we created this report and kind of some of the things that we're looking for towards the future. So going into what is in the report itself, and what I will say is, before kind of going into some of the details of this, we are, as I had mentioned before, this is kind of the inaugural report. So we are planning to do, updates on this in the coming years. So if you have other ideas on this, please let us know. We always love the feedback, always love people's thoughts and perspectives on these different pieces. So please do reach out to us with any of those thoughts for the coming pieces or other things that we're doing. The second thing that I will mention very quickly is that what you'll see in a lot of this and what I will be going over is kind of a high-level overview of where you can find the data and what that looks like. So I'm not going to be going into, here are some of the really specific pieces that you can find, et cetera. But if you are interested in that, for example, if you have a group, or even as an individual, if that's something you're interested in, please do reach out to us. We are always happy to dive more into the data with others. But again, this is just a very high level overview of a lot of the things that we looked at. So looking at the report itself, and then if you take a look at the report, and we can put the link to the report in the chat. But what you can find in there, you'll find a more detailed methodology of how we came about this and how we chose the different metrics, et cetera, et cetera. So you can find that more in the report itself. But what I will say is that we worked with a number of community groups, as I had mentioned before. Those 5 organizations that were really part of this advisory group played a very instrumental role in helping to shape this, as well as a lot of the work that's already been done in Colorado. But in trying to choose and then trying to look at some of the metrics we wanted to examine, we kind of clumped them into 4 different categories, right? So we have a financial category, a financial security category. We have, someone's ability to live in their community of choice, health as a category, and we meant that to be all inclusive. So we have kind of your physical health, we have your oral health, we have your mental health, et cetera. And then also just general quality of life statistics and data. So that's kind of a broad overview of the data. I'm going to get into kind of where you can find that, what that looks like here in just a minute. But the one thing that I do want to spend just a little bit of time on before digging into that is that we do also have a separate, what we found is that across all 4 of these different issue areas, there were kind of 5 major takeaways, right? Like 5 trends, I think, that really stood out just across the board. So we note those in a separate report. I'm not going to spend a whole lot of time on these right now, but again, you can find this in the report. But just to touch on them very briefly, what we found was that economic insecurity was something that was significant for a large number of older Coloradans. We also found, and I will say that this was a tremendous piece just across the board, when we took a look at the data, the racial disparities for older Coloradans who are Black, Indigenous, and people of color, it was just tremendous just across the board in all of those different categories. Similarly, we saw that, if you take a look at where you live in Colorado, there are often significant gaps in where those services and supports exist. I talked about this before, but we'll come back to it again. But there are also significant gaps in the data, and that makes it very hard, especially whenever we are trying to assess, how, many groups who've oftentimes been marginalized are doing. So there was virtually no data, for example, on LGBTQ older Coloradans. A lot of the data was missing around Coloradans with disabilities, and lots of gaps elsewhere as well. And then the final thing that I'll just mention just very quickly is that if you take a look at it, what we find here is that Coloradans as well have been making, a lot of progress in the important policies kind of supportive of older Coloradans just across the board, just in a variety of different ways. So those are kind of just a couple of the key findings that we've seen. I'm going to spend just a little bit of time looking at and showing folks how to examine and where to find the data that it kind of exists across the board. So I'm going to stop sharing, and I will show folks just kind of where to take and find that data. All right. Okay, so I believe that Julie has put into the chat box, oh, in the wrong place. Okay, so I believe Julie has taken, put the, into the chat where you can find the information about, kind of takes you to the landing page around our report here. So just to, again, very quickly walk through this. Again, feel free to reach out if you do have other questions or other things that are coming up with this, or if you would like to have us walk through this, some other time as well. But just to quickly walk through this, again, this is where you're going to find this report that I had just mentioned with those 5 major takeaways. But then these 4 different kind of boxes here, that's going to show you, and that's going to bring you to a lot of the data that I had just mentioned. Ooh, so to walk quickly through this, I'm going to go back and actually choose this one. So if you choose any of these, you're going to kind of find the same different kind of overview. It's all going to be structured in the same way. But what you'll find in this is going to be kind of that top level data first. What we wanted to do with all of this is to say, here is some top level data, where if we're looking at kind of the financial security of older Coloradans, here are a couple of the, the top thing that maybe is a good indicator. So for example, if we're talking about financial security, you're often going to be talking about the federal poverty threshold. So as mentioned before, you can take a look over here. We have kind of a general piece over here where, you can kind of take a look based upon a number of different demographic characteristics and, geographic location, et cetera, as I had mentioned before. And then moving beyond this, what we had also wanted to do, we know that this top level data and that top level metric doesn't tell you everything about how older Coloradans are doing. It's not the only important metric that there is. So what we also did, and again, you can find this in all of the different categories, we kind of did a deeper look into then saying, okay, so what might be some of those other things that might be contributing to that? So for example, if we're talking about financial security, we're often going to be looking at things like income and expenses. So within this, we take a look at expenses. And I will say one of the major things we found was that home ownership was a major indicator of someone's expenses, right? If you are a renter, you own your own home, et cetera, et cetera. So what we have here is we kind of break it down based upon your expenses, based upon all of those different pieces. In a very similar way, we break it down, for your income. So we take a look at 3 different, major sources of income for older Coloradans, your wage, your retirement and pension income, as well as your Social Security income. And within each of this, we take a look at how many people are collecting money that way, what is the median amount that they are receiving that way. And so again, we do this for each of those different categories. The one thing that I will also mention across this that we include in all of this is that we know that those are kind of your initial metrics right now, right? So how you are doing kind of with the federal poverty threshold, the income you are taking in, et cetera, that is one kind of where you are right now. But if we want to see change, we also need to be taking a look at those systems which are leading to those different outcomes. So across each of these different pieces, we take a look at those systems. So for example, within, some of the levers that could make change for this, to increase your income, we talk about the secure savings program and how we can look at that in the coming years. Similarly, we talk about workforce supports and different things that can help, increase people's income in the coming years. So again, that is just a very brief overview of kind of, walking through the State of Aging report itself. Again, please do reach out to us if you have, additional questions, if you have additional ideas. We are always more than happy to talk. I am going to just finish up here by kind of transitioning into our panel conversation, because I think one of the things that, again, we really wanted to look at, oh gosh, kind of skipping around. One of the things that we really wanted to be taking a look at with this, and we hope that this presentation, and I think the report more broadly can be used for, is to say that aging is not a siloed issue. Is that if we're looking at issues around aging, that the issues, that impact older Coloradans are also those that are being talked about more broadly within the broader community in our public policy, et cetera. And that's the case for economic insecurity. We know about 20% of older Coloradans are living in a household where they're economically insecure, at about 200% of that federal poverty threshold. Similarly, if we take a look at home ownership statuses, especially those who are renting, or who may be kind of housing insecure, et cetera, we know that this is something that's also impacting a lot of older Coloradans as well. And we see that in the data that we also looked at for this report. And then finally, in a very similar way, what we also see is, as we talk about issues around labor force participation, older Coloradans, again, they're the fastest growing segment of our labor force as well, matching our change in demographics more broadly. So as we talk about labor force in Colorado and we talk about the needs of our labor force, they have to be an important consideration when we look at these different issues in Colorado. So I think hopefully that sets us up well for the panel conversation we're going to be having with a couple of our amazing partners. I'll stop sharing now. So before jumping into the panel conversation, again, we're going to be talking with both Diedre Johnson and Shannon Secrest. And then I would ask first, I think, Diedre, if you wouldn't mind just taking yourself off and from mute there, and if you want to just introduce yourself.
Thank you. Thank you so much for inviting me to be here today, especially for this important topic. So my name is Diedre Johnson. I'm the CEO and Executive Director for the Center for African American Health. Excited to share this is our 25th year. We actually started back in '97 as the Metro Denver Black Church Initiative, and then became the Center for African American Health in 2005. And really for those first 10 years of being the center, our sole focus was senior wellness, helping seniors and elders manage chronic disease, as well as how they could be connected to resources they needed to stay in place and age gracefully, or as one of our popular classes is called, Aging Mastery. During the past 6 years that I've been there, although we have changed our model and we really are seeking to serve entire families as well as seniors, our senior programming is still vibrant and an important core to what we do. And it's interesting, in our community, you'll find seniors that are taking care of their grandkids. So they're going to have a lot of the challenges that others have. And it's also important because, as we navigate these systems, there's so many things so many challenges with regard to health disparities and living a healthy life that just magnify as folks get older. And in fact, I'm really pleased to also have my other colleague here today, because I will share briefly that I was at in Arizona right before the pandemic. There's a group in Arizona that does an annual African Americans and Disability Conference. And one of the things that was made very clear is while we don't talk about it as where folks are younger, as we age, larger proportions of our community also have disabilities. And so pleased to be here today, and we'll looking forward to sharing really our hopes and goals around supporting seniors, not just to be healthy, but those social determinants of health.
Wonderful. Thank you so much, Diedre. And again, we are so excited to have you both as a partner and then here today. So we will also then move to Shannon, who again is with the Colorado Cross Disability Coalition.
Hi, Andrea, and thank you again for having me here, and love working with the Bell and all of the staff, and especially on this project. I am the Deputy Executive Director of the Colorado Cross Disability Coalition. We are actually a statewide organization that has been around for a little over 30 years. And what we do is we advocate for disability rights. And the reason our name is Cross Disability is because we really do work with individuals, service providers, businesses, any governmental agencies, public stakeholders, you name it, in regards to folks who have any kind of disability, and that includes from birth to death. That includes, anyone who has physical disabilities, Down syndrome, CP, spina bifida, including neurodiversity like autism, certainly folks with brain injury, mental and behavioral health, and certainly those who would be deafblind, and many, many more who would identify as being disabled. And so we do, again, work across the state. We work on equal rights and equal access. And I think that's probably one of the key takeaways for our organization is always about access. Of course, our motto, which many of you I'm sure are quite aware, is nothing about us ever. And that ensures that we are full participatory stakeholders in the process that creates policies, rules, regulation, anything that would affect those with disabilities. And I would just say that the one distinction is for us, there's a difference between aging with a disability and aging into a disability. We know that many older individuals will have hearing loss or limited mobility, those kind of things. However, for us, many of our community and population have a disability and then age. And so for us, we believe firmly that disability is a natural part of the human existence. So I'll just pause there and we'll get into more with the.
Wonderful. Thank you so much, Shannon. So again, as was mentioned before, if you do have a question, feel free to put them in the chat and we'll see, hopefully we can get to lots of folks throughout the next 20 minutes or so. So while people are collecting their thoughts and putting them in the chat, we'll start off with a question here. I think, both of you, mentioned this a little bit as you were, talking a little bit about it and giving your introductions here. But, I think one of the things that we really, talked about in the report and really came out is, again, that aging looks differently for every Coloradan based upon, any number of different, factors. So, with that, and Diedre, we can start with you. If you could just talk about anything that you would want to highlight about, that you see with, regards to the aging experience for the folks that you serve at the Center for African American Health.
Well, our community suffers from disparities in just about every health category you can think of. Sometimes I use the rule of 3. Because just about every disparity you can think of, whether it's diabetes, heart disease, dementia, asthma, we're usually 2 to 3 times more likely to get it, be hospitalized, and die from it, whatever it is. And so when we look at what's happening with our seniors, it's been really interesting because those things that we look at when we think about diabetes and blood pressure, while it can happen when you're younger, rarely, it typically happens to our elders. And so a lot of our classes that we do are really helping people to manage that. Ideally, we can prevent it earlier altogether. One of the things we really saw during COVID, which was heartbreaking but but we were glad we were there, is the moment things started shutting down, constant reports of seniors without access to food. One thing that a researcher friend of mine on the East Coast has been working on is we already know that African Americans are twice as likely to get Alzheimer's. Well, during the pandemic, because of increased social isolation, we've experienced not only more dementia, but the onset is faster. And, not only is that being seen in senior living, but in families. And I've had that happen, in my extended family. So I think one of the other challenges is when you think, especially when you think about the economy, while folks of all ages have struggles, seniors, not only are they dealing with economic challenges and also kind of discrimination on the job or the ability to be employed or having to work when you'd rather be retired, but they're often taking care of multiple generations. And so even though we talk about 2-gen approach to childhood, we really think about 3-gen approach because we have lots of seniors who are the primary we're helping them navigate school systems. And so it's definitely not one size fits all, but all of those disparities that you think about when you think about living in a systemically racist system are amplified when it comes to seniors of color.
Thank you so much for that response there, Diedre, and for touching on, I think, so many different issues within that in a very short and succinct response. Shannon, wondering if you could talk a little bit and, to the same question as well.
Sure. So I think one of the things that we highlighted or brought forth in this work was many people with disabilities historically have not even had the ability to age, right? Age into older life. And it was simply because our health systems, our care systems, were certainly not ever set up. The propensity was more to place folks into institutions, even younger people. We've certainly seen that with films such as Crip Camp, where they had young folks who were trying to break out of nursing homes because those were the only places available for people with disabilities. And again, we know that typically life expectancy in a nursing facility or in many cases just plain out institutions is much shorter than living in a home and community-based setting. And so I think that's the one thing that we bring forward is when you talk about the data is not there because our community didn't get to age into the data, right? Many of our community were lost to death. Simply because of the systems that were created. And I love what Diedre said. I think there are so many factors because for us, the intersectionality is that it doesn't matter your race, religion, creed, sexual orientation, sexual expression, demographic, location. The intersectionality is that you can become disabled at any time, whether it's through birth, whether it's through an injury, an accident, through acquiring dementia or health disparities. And so for us, our community reaches across every population. And so it's also hard to tease out the distinction between is it a dual purpose or dual existing condition such as racial inequity, health inequity, and a disability. There's so many factors that go into the data. And so that's why I know we'll talk more about that, but that's why that aspect is so important for us.
Well, thanks so much, Shannon. And that leads obviously perfectly right into the next question. So thank you so much for teeing that up so well. I think, again, one of the things that we really noticed throughout this report, and I think both of you have mentioned it to some degree in your responses to the previous question, is that there is that lack of data that, again, especially as we think about for, again, populations that have historically been more marginalized, we don't have a lot of that data, which makes it very difficult to track and to assess how we are doing. So I think, Shannon, we can start with you on this one. Thanks again for teeing that up. Was wondering if you could talk, both of you, and Shannon, again, we'll start with you. If you could talk a little bit about how you see some of that data, those data gaps playing out. If there are spaces where you notice that as being more prevalent, and then the kind of the follow-on question to that as well is how do you see that, and what do you see the impact of that being within the policy space?
I would say even from our own research and the research done through this project is the data is lacking for sure, not only for Colorado, but nationally as well. And I think for us, we look at places such as, when Rutgers does voting information or when the census comes out, there are not questions on the census that identify, a disability or status or how you would identify. And again, I know census only comes out every 10 years, but even that limited data would inform, right? It would inform, we think of things like redistricting and we think of policy changes like that. And so that's where the data can influence, and certainly in all of our systems, again, whether it's SNAP programs, food programs, housing programs. I mean, if we have the data to show that, much like the report touches on, that the majority, or not more, at least half of the folks, are renters. And so is there affordable, accessible housing? Because is that yet another barrier to home ownership? Because there certainly aren't homes that are available. We also saw during the pandemic, when public systems shut down, folks with disabilities couldn't get on the bus, right? We don't have the access to Uber and Lyft and even private enterprises such as those to get out of the house. So you talk about the social isolation. And so if we had data around how many Ubers and Lyfts are handicap and disability accessible, right? Even simple data such as that. We also know thinking about Medicare and Medicaid and all the systems to show how many people are duly enrolled or would be eligible. There is so much data that could be compiled that would inform our health policy, our transportation policy, even our food policy and housing policy, that it is critical that we start examining where and when and how we collect and utilize it to be able to inform, every system that affects a person's life.
I appreciate what you kind of mentioned there, I think, Shannon, talking about kind of that holistic nature around that lack of data and how that really impacts kind of in all spaces. So Diedre, I'll kick the question back over to you to see what your thoughts are.
It's interesting. I think there are a couple things at play. There are systems that were designed not to collect certain data because people measure what matters. And if certain people don't matter to you, you're not going to really want to know what's going on with them. And then there's how to get folks to respond if they're used to being not treated well by a system. So I've been working in the nonprofit industrial complex for a long time. And that was really, whether I was fundraising and philanthropy or doing other things, I was always frustrated because when I would ask, where's the data around people of color? I'd be told, oh, well, we don't have it. It's not statistically significant, or let's take some census data and make some assumptions. And I really wanted us to get out of this having to rely on secondhand data. So one of the first things we did in 2016 with support from the Health Foundation was we started Be Heard Mile High. And we got help from the folks in Be Heard Philly, but we actually have our own community health panel. And the reason I did that was when I was talking to my predecessor, he had mentioned that in 2011, we had surveyed churches and had 2,000 respondents. But I found out from CDPHE, the most they had gotten was maybe 200. And so what that said to me is it depends who's asking the question. And so now we have kind of our own little panel, and these folks have stayed in there. I checked, and as of today, about 40% of them are seniors. But we do many surveys to kind of see, like, short questionnaires. It can be snail mail, email, or text, just to see what they think about topical things. And so our next step is kind of to use that to inform things we want to advocate for. With regard to systems, I know that, for the last 15 years, we've been able to measure life expectancy down to the zip code. And so I think a lot of that is just a choice. And there's some states that have chosen to really highlight and mandate that certain things be tracked. And I think we're trying to do better. But if the will is there, these things are easy to solve.
So yeah, thank you so much, for that question, or excuse me, for that response, Diedre. And I think that the work that especially in kind of collecting that data again is just so important. And I think that your response though, I think really gets to the next question that I have for both of you. As we think about, I think in both of those questions and throughout, we've really talked about kind of how there's the lack of data. And I think as you had just mentioned, Diedre, there's the question of is there the will to do some of these different things? Is there the will to move some of these either policies forward, collect this data? As we think about these policy solutions, or as we think about the ways in which, either, we've touched on issues of affordability, we've touched on issues of data collection, et cetera. Are there policy pieces that really kind of come to the front for you and saying, these are the issues that I think are kind of the most important to be thinking about, again, as we think about our older Coloradans, that again, really come to the forefront for you. So Diedre, I'll start off with you for that question.
I have to say, I don't have specific issues at the moment because we're moving more into this space. But I would say the number one issue is just affordability. Something is minor for me. My Excel bill doubled last month. I was livid. I called and was fussing and was only told, well, the rates have gone up. And I'm like, we help people get utility assistance. I'm like, if I'm irritated, but I at least have options, think about those folks who don't have that money. And so there's got to be something we can do. And I was sharing this with my sister, and she was like, well, I don't know what country it was, but one country recently said that for the impoverished, their utilities will be free. Now, I don't imagine us doing that, but there are just certain things that just don't need to be. And ultimately, it comes down to what kind of world we want to live in. And I always share this example because years ago when I was a fundraiser, I was at a conference and I was talking to a woman, and she worked in the hunger space. And she shared with me this amazing tagline that stayed with me. And it was, hunger hurts, not only those that experience it, but the community that allows it to exist. There's too much that we allow to exist that we don't need to.
Yeah, I think kind of what you're talking about there, Diedre, is really about how oftentimes that this is a choice of what we do or don't allow to have happen, which puts the ball, I think you're right, directly then in all of our collective courts to then move the policies that we want to see forward to make the world what it is we want to. So Shannon, then I'll kick it over to you to see what kind of things you are thinking about.
It's funny, I actually had Excel as well, simply because they put out that they'll be raising the rates from $45 to $65 a month between the months of November and March. And to your point, I mean, can you imagine how catastrophic that is for older people and people with disabilities who don't leave their home to go to work and don't turn down that thermostat? Or we actually had clients who commented to say, my spouse, my partner, whatever, is on a ventilator and needs, all of this oxygen equipment and has all this extra electrical use. We have electric beds to get our folks out of bed, charging wheelchairs, equipment. So it can be catastrophic for if you have a disability and you're aging, and you certainly don't have the income to be able to account for that kind of inflation. We've also seen that inflation nationally has gone up 7%, and it's the highest since 1982. I just looked at a Market Watch report. that said groceries, food has gone up an average of 28%. And so again, when you look at this huge increase and knowing that once you've aged into that realm that you're maybe not earning a full income, or you're not, you're relying on pensions or Social Security, those kind of things. And again, with disability, most people, you have an asset limit of $2,000. So you can't have assets and income. So it's those kind of things that perpetuate the existence that we have. I don't know if you want specific things. I mean, the Polis and Primavera administration just put out that they are going to extend the property tax, rent, and heat credit rebate. So those who are, I believe, at 150% FPL can get a 976 rebate, and that's for older adults and those with disabilities. So that's a very small thing that's being offered. Also, legislation this session is looking at the modernization of the Older Coloradans Act. So again, that can maybe help mitigate some of it. We also have HB 1018 that's looking to give those protections for electric and gas so that folks don't get their bills, so they don't get their utilities shut off regardless of ability to pay. And I think we also look at things like HB 1026, that's alternative transportation taxes. Again, we just need to think about, I would even say last session, we had some great renters' rights legislation. We have things like COFA, which is Colorado Housing for All. I think it's multi-purpose. Again, I think it's the will. What's important is what's going to get moved. And so I think that's where we need to bring our voices and our power forward, is to say, this is what matters and this is what affects our lives, regardless, again, whether you're a person with a disability or a person aging, these things are going to affect us through our death. And so these have to become policy and legislative priorities for everyone.
Yeah, thank you so much for Shannon, and for mentioning a couple of those very specific pieces of legislation, I think this coming legislative session and the previous legislative session. And so I know that we had a number of different questions. I think some of them we can also kind of get back to a few folks. I think there was a question about Alzheimer's, and I believe some of that work around kind of fitting into this project. And I think that that's definitely something I think to consider, that we would love to consider more. I think moving forward for the next iteration of this. I think that there were kind of a couple of different questions, around kind of the homestead exemption and a few of those other pieces as well. And I will say, and I'm so sorry we didn't get to more of these questions. And for those who, if there are a couple other pieces, we can always reply to folks individually. But what I will say with all of this, because we are running with about 2 minutes left or so, that we are again going to be coming out with kind of a second version. I wouldn't even say a second version of this. But what we are going to be doing is we are going to be coming out with kind of building on this work, in the coming years, but also in the coming months. We are planning to dig deeper into a number of these different issue areas that have really come up throughout this first report, and working with a number of the great organizations that we had the great fortune to partner with this past year. So be on the lookout for that. I think that there were also a number of questions around some of the financial pieces, in the question and answer, in the chat box. We are also going to be doing kind of a financial analysis of those things. I think, Phil, I saw your question, so we can always talk more about that as well, because that is always a huge question. And then finally, I will put in a plug for a couple of our other work that is going to be coming out. Again, the homestead exemption was mentioned. We are going to have a piece coming out by one of my great colleagues, Catherine Dempsey, who's going to be working on a piece around housing and older Coloradans, and another about growth in Colorado and some of the demographic changes, again, by another one of our colleagues, Teddy Weiss. So be on the lookout for those. And again, just wanted to thank you all for taking the time to be here today. Thank you so much to both Diedre and Shannon, again, for taking the time to join this. Your partnership is invaluable, and we really enjoy working with you. So again, thank you to everyone for being here today. Please do reach out if you have any questions or thoughts, or would like a presentation, or would like some more data. We really appreciate all of you. So thank you so much, and enjoy your afternoon, everyone.